Heidi, and we're continuing with my part 2 oral hygiene instructions on flossing. And we're using my model, Molly, to show an adult the proper way to floss. There is many different types of flosses, strings. You can use wax. You first want to start off, whichever one you prefer, want to start off wrapping around your middle fingers. And you want to get them close, about, let's say, 1 inch to ½ inch. And you're going to use your thumbs to press. And you're going to use your pointer fingers, too, to help position it in where you want it. Okay. Now I'm going to show you how to hug the tooth. Not everyone knows how to do that. And to get behind that back molar, because everyone always thinks you don't have to floss back there since there's not a tooth next to it. But you always have to get on each side of your tooth, not where the toothbrush touches very well. And here we go. I'm going to start off in the back part of her mouth and behind her molars. Good.
Doing good.
And you're going to want to seesaw. Oh, in between the contacts. You're going to want to shove it back there and go up and down. Let's do some anterior so you can see it. And you want to do this on each individual tooth. Once you seesaw, let's do this. Seesaw in between the contact point, or the area where the 2 teeth are touching, where it's hard to get through, you're going to want to push it against one side of the tooth. And you're going to want to hug it like a C shape. You're going to want to go up and down with it. You don't want to pull it all the way. There you go. About 3 to 5 strokes for each side of the tooth. You're going to want to you want to stay in there. Don't pull it back out and then have to shove it back in the little contact point. And you're going to want to go on this side of the tooth. And you're going to want to go up and down. And then move on. You're going to want to change the piece of floss that you're using by wrapping it tighter on one finger, looser on the other, so it's switching to a cleaner part of the floss. And then you're going to want to go to the next tooth. Seesaw, shove it on, shove it on the side of the contact point, shove it on that side of the tooth. And go up and down. And then you're going to want to go to this side and up and down. And then you're going to want to do that on all these teeth. And the very back molars, you're going to want to get back there again. I think it'll be easier to show you on this model. You're going to want to get in the way back, in between that gum line. In between this gum line. You see it back here?
Yes.
Okay, closer. And you're going to want to go up, up and down, even though there's no tooth behind it. Because there is still plaque buildup back there. And that is your oral hygiene flossing. Thank you.